Hi, my name is Teresa Cox, and this is my final capstone presentation. My public issue is breast cancer screening. The American Cancer Society reports that breast cancer is more prevalent than any other type of cancer in Nebraska. They also report that Nebraska women are diagnosed more often than the national average. In 2023, we will have 1,670 new cases and 270 deaths. Dr. Watanabe Galloway from the Med Center in 2022 reported that African American women in Nebraska have a higher mortality rate than the national average. In fact, they die 3 times more often than other Nebraska women. This is me in the picture. Breast cancer screening is important to me because I was diagnosed when I was 50. It was through a routine mammogram. Some calcifications that had been seen on a prior mammogram had now clustered, and I had a biopsy and was told I had cancer. So in 2017, Providence Health Team reported that tumors can grow 2 to 5 years before they are felt. This is significant because most patients are asymptomatic. I certainly was. And because I went in to have that early, a routine mammogram, that early detection increased my survival rates. So an educated citizen is an effective communicator, a reflective individual, and a change agent. This is an example of me being an effective communicator. She wasn't my patient, but she was on the floor. I was on the acute rehab. It was a 21-year-old girl who had went to the hospital with a headache, and they did a scan and realized she had a brain tumor. After that was surgically removed, when she regained consciousness, she was blind, and so they were teaching her how to walk. They had shared in the handoff report that she was depressed. And when I had walked by her room, I certainly noticed that she didn't have a television on and she wasn't listening to music. She didn't have any visitors. She just was sitting there staring off into space. And so I asked the nurse if we could put in a referral for a healing touch consultation. What I learned that day is that you have to have confidence as if an effective communicator so that you can maybe identify something a patient needs and then take action to make steps to help them. The same is true with breast cancer. If we, as a nurse, can identify maybe a resource that is not currently being used, we would have, if we have confidence as an effective communicator, we can bring that to the manager. An example of a resource might be the Every Woman Matters program. It's it's put together by Nebraska Health and Human Services. Also, as an effective communicator, excuse me, I had a patient who decided to labor naturally. It was her second child. We did lots of interventions with her, but at some point she decided that she wanted to get into the bathtub. And that was kind of an awkward situation for me because I didn't know what she would feel comfortable with. I didn't want to encroach on her personal space. But the nurse that I was shadowing brought in lots of towels that she could drape herself with, and I thought that was genius. So what I learned in an awkward situation, if we can speak in a calm voice and we can ask a patient, what do they need? What can I provide to you right now to give you some comfort? This can be significant if we are teaching breast self exams, asking a patient if it's okay to touch them, as we might have to do that, asking them what do they need to feel comfortable, and always speaking in a calm voice um, to help them relax. As a reflective individual, I had a patient who I spoke of often in my years at Methodist College because she had such an impact on me. She was one of my very first patients. She was a 27-year-old who had been in a near fatal car accident. The car she was riding in had crossed the center median and struck a semi head on. Her two friends in the front seat were killed instantly. She was ejected from the car. She was life flighted. She had multiple fractures in her wrists and her elbows and her pelvis. She had cranial nerve damage, contusions to the chest. She was lucky to be alive. When I saw her, it was 3 months later. And at that time, we did our pre lab in the hospital the night before. So I had gotten the information about her, and I went home that day and looked her up on the news and saw the footage of the accident. And so I was nervous about what I was going to see, who she would be, and what I would encounter the next day. And so that was one of the first things I learned was anticipating the needs of a patient prior to their assessment. Um, and what it really was anticipating or needed to anticipate was the importance of her emotional needs. I sat with her for probably 30 minutes before I ever did her assessment, hearing her talk about those best friends and her telling me her story and how her and her mother had been estranged. And now her mom was taking care of her 6-year-old son, and they lived in Ohio, and she was in Nebraska by herself. And how her mom would FaceTime her every morning so that she could see her mom getting her son ready off to school, and the range of emotions that she went through that day, from so energized in the morning to, crying out in the afternoon, why did this happen to me? And so that's really what I learned that day, is just the importance of a patient's emotional needs, how they are just as important as somebody's physical needs. So this can be important when we are talking to patients who are at risk for breast cancer. It can be a very sensitive subject. Um, a patient who has a personal history needs extra compassion and empathy because maybe they had a mother or a sister or an aunt or a grandmother affected by this terrible disease. When we anticipate their needs and understand the importance of their emotional needs, we can give them comfort. An educated citizen is a reflective individual, and this situation was with a difficult patient that I had, who we were told in the nursing handoff report outside of the patient's room that she was difficult. She occluded a line of blood products that had been given to her. She had claimed that she didn't speak English. In reality, she did. She would spend 30 minutes in the bathroom washing her hands. And so I just decided to take her on because I thought that if she was difficult, then I would take something off of the nurse I was shadowing, her plate. And so I just took the time that I had with her to build a trusting relationship. And I taught her how to swaddle her baby. She was a first time mom. I taught her breastfeeding positions. I helped show her how to get the baby to latch. And, but during our shift, she spiked a fever and she did not want to go down for the x ray. Um, and, but because I had spent that time with her building that trusting relationship, I was able to talk her into going. I shared with her, I knew how important it was for her to get better and go home and take care of her baby, and that she had spiked a fever, which was kind of unusual. And she asked me what a fever was. And I felt really bad that she had been there for 2 days and she still didn't know what a fever was. But she wasn't from the United States and there was a language barrier. But really, what I learned was that because I had built a trusting relationship with her, she was then able to promote her own health. She needed an x ray. She agreed to go down and get it as long as I went with her. Um, and so I gave her some tools through that trusting relationship in order to promote her own health. So when a patient has a risk of breast cancer, and we need to talk to them about that, we need to build a trusting relationship. Um, if we hope for them to follow through on the recommendations that we give, which is why it's so important that we spend that extra time listening to patients' concerns, developing that trust, making those recommendations, and hopefully they'll listen. But we have a better chance of it if they trust us. An educated citizen is also a change agent. I had a patient who had unmanaged pain. She had came into the ER, had delivered cesarean 3 days prior. They gave her some oxycodone. They sent her upstairs with a diagnosis of cellulitis. When we assessed her, she claimed that her pain was a 6 out of 10. When we went back to the doctor to report that, because there was no PRN medications, The doctor then ordered further tests, thinking that maybe cellulitis wasn't what she had. So we had some additional tests on board. We still had not addressed her pain. When we went back in to tell her that the ultrasound was inconclusive and that now we were going to do a CT scan, she seemed agitated. And so I asked her, what her pain was then, and she then reported it as 8 on a scale of 10. And the nurse didn't address it. She just said, we would come back and check on her. When we went outside of the room, I asked the nurse, were we going to do anything? Could we call the doctor? And reminded her that we hadn't given her anything for the pain, and now she was reporting her pain as an 8 out of 10. And so the nurse then called the doctor, got a PRN medication we were able to give her. So what I learned that day is that by bringing my concerns to the nurse, I could be a voice for the patient. I can advocate for my patient and what they need that might be unsaid. With a breast cancer diagnosis, it can be very overwhelming. I remember being told that I had cancer and I didn't prepare any questions. I didn't know what questions to ask. I heard carcinoma in situ and I had no idea what that meant. And so, as a nurse in the future, I can anticipate getting questions or concerns from patients after the diagnosis because a lot of times, and the time that you're getting this information, you don't even know what questions to ask. And so, that was one thing as a change agent that I could do is make sure I'm listening to my patients and the questions and concerns that they have, and then relaying those back to the doctor. And my last example of a change agent was when I went through my divorce. I was married for 25 years, and at the time we told our children that we were getting a divorce. Their main concern was that we would no longer be a family. My ex-husband and I had both been through divorces, so we know how difficult it is. And so we made a promise to our kids at that day that we would always be a family. And so I had to navigate getting through that. It was easy to agree to, but making it happen was a whole nother thing. So I read a book called Conscious Uncoupling, and it really gave me some skills. Active listening was one of them in order to resolve conflict, to navigate this new normal that my ex husband and I were experiencing. And on the other side of that, we still spend the holidays together and we go on vacation with our kids in the summer. We were able to do that because of this conflict resolution of active listening that I learned. The same is true when we're dealing with patients who are opposed to being screened. Maybe they're afraid that it's going to hurt, or maybe they're afraid of being diagnosed. When we actively listen, understand the reasons why they don't want to be screened, um, we can encourage them, to take action and be screened. In conclusion, so I didn't know anything about this demographic of African American women and these statistics, but it's sobering to me. I was outraged, to be honest. It really showed me how health inequities can be devastating. Um, I enjoyed linking the reflections to the public issue. It helped me to see how the things that I have learned could help me be as a future nurse. I also enjoyed putting the portfolio together. It was fun going through the reflections. It gave me a chance to kind of reminisce about uh, some of the wonderful patients that I've had in clinicals, since I've been at Nebraska Methodist College, and to be able to see the growth that I've experienced. And so I just am so grateful for this opportunity and this experience of being at the school and all the things I've learned. And I just couldn't be more grateful. Thank you. Oh, you want